Welcome, everyone. My name is Pam Dunwald, and I am the founder of Patient Advocate Match, which we have a directory of services for healthcare professionals. So today we are fortunate to be able to visit with Katie Niznik. Katie is the mental health director and mental health and wellness director for Turning Point, which is a nonprofit agency that services survivors of sexual violence and domestic violence and sexual abuse. Is that right? Okay.
Correct.
And that's a mouthful for me, but in River Falls, Wisconsin. And so we are super excited to talk to Katie today because October is Domestic Violence Awareness Month. And so I wanted to bring Katie on and have her share a little bit about some things that maybe people should know about. So Katie, welcome.
Thank you. Thanks for having me. So yes, October is Domestic Violence Awareness Month, or Intimate Partner Violence. And so what we really want to bring to the forefront is that the violence that people experience is not their faults. One, it's complicated. Relationships are not black and white. There's a lot of gray areas and things that we function in, which I'm sure we're going to get more into later. So that people don't deserve the violence that they experience. It's not their fault. It's the perpetrator's fault. And that domestic violence or intimate partner violence is a community issue. It's not just a single private family issue.
Okay, so briefly, Kate, I know you have a shelter, and I know that's not the biggest part of what you do, but just tell us a little bit about what the shelter does.
Sure. I mean, well, Turning Point, as we were talking about, provide services. So some of those core services that we provide to victims and survivors are information referrals about resources, which is one of the biggest things that people utilize, right? Nobody ever expects to be in that type of a situation. And so having a confidential, non-judgmental place to turn to talk through options and resources is very helpful to people. So information referrals, we provide emotional support, and that can come through one-on-one meetings with our advocates, people like myself, or we do have support groups as well that people can, if they're looking for community to belong to, with people that have had similar experiences to them. Sometimes that can be really validating too, because domestic violence is very isolating. So we offer support groups. As you did say, we do have a shelter as well, emergency shelter. We provide hygiene products, food. So it's hard to focus on other things if our basic needs aren't being met. So it's important that we are able to provide those for the people that we're serving and sometimes it's just a temporary thing, to connect the dots while you're having a transition. And so we can certainly do that. We have a Second Chances thrift store. So our clients are able to access that with vouchers. We do a home start program. So as people are transitioning to safe housing, they oftentimes will need something to just get them started. So with this home start voucher, they can receive like a kitchen startup box with like pots and pans, a couch, a lamp, things along those lines to make their home a bit, homier for them. People can also receive clothing. All of our donations, our clients have access to those, and then the proceeds from that store go to funding Turning Point day-to-day activities. We also have, I'm trying to think, when you're doing something every day and then
Legal advocates, you do legal advocacy. Okay.
Oh yes, that is that's a big part. I mean, because the legal system is very daunting, and can be difficult to understand. So we don't have attorneys, but we provide legal advocacy, which is providing paperwork. We help people, go through that paperwork, help talk through options and things with them, are there for support, because it is very intimidating to be sitting by the person that has been abusing you, that has all this power and control over you. So we provide emotional support in that way, or just being with people during court. That service representative, that's what the term that I was looking for. um Assistance with restraining orders, things like that. So information referrals, support groups, restraining orders, basic needs we help meet. We assist with emergency transportation within that, our shelter program. um the other programs that we have as well, we serve victims and survivors throughout the lifespan. So we have a child and youth program. Um, we work with people with that have experienced higher needs, like different barriers. So people with um different cognitive abilities or physical abilities, people belonging to the deaf community, um, other marginalized populations too, like the Black community, the Latinx community. All of those groups have higher rates of this because of their higher levels of oppression, and they have more barriers to receive services. So that's part of the work that we do too, is to try to eliminate those barriers for people so that they can access the same services as well.
And I know, Katie, that you don't know this for sure, but to give people that are, maybe outside of our area or outside of the Wisconsin area, do most shelters or most states have these type of programs that no matter where you live, these type of things can be accessible?
Yes. Yeah,
How would they find out? Where would be the best place to reach out to find out what's available in their area?
sure. The place to probably start would be the National Domestic Violence Hotline. So one of those national hotlines will be able to refer to places in their areas. So that would probably be a good place to start, is just Google National Domestic Violence Hotline. Of course, we want to be mindful with that, right? Because our technology and things can be monitored. So we want to be careful when we're searching for those things, making sure that we're deleting our history, or maybe we are searching for those things with the incognito mode. So it's not tracking your web searching and things like that. But a national hotline would probably be the best place to start, because there should be something in that service area. Like, for example, in Wisconsin, Turning Point serves Pierce and St. Croix counties, we, over by the Twin Cities, but there should be an organization that covers every county in the state of Wisconsin. So
Would you say, like, it's safe to say if they want to Google this information, maybe go to the library and get on a public computer or something, versus using something that is in their home or their phone where, possibly the perpetrator could get access, and then things would escalate if they know they're searching for that?
yeah, I mean, that's definitely an option to people. I know sometimes, especially in rural communities, like transportation can be an issue. But I mean, going to the library is definitely a good option for people to do that, to search on a public computer so that it doesn't tie back. But again, the other things too, if people don't have that accessibility, there are ways to um delete your history and things like that, so that people can't track it too.
So Katie, what are some of the barriers that you see in preventing or dealing with these cases of domestic violence?
Sure. There's a lot, because I know that's really easy from the outside looking in to be like, well, why don't they just leave? Or why doesn't she just leave? Why doesn't he just leave? Right? It seems really cut and dry to people if they're not directly experiencing it themselves. But the whole point of intimate partner violence or domestic violence is power and control. So it's that goal of that partner to make their spouse, boyfriend, girlfriend, partner, what have you, dependent on them. They're going to try to create those circumstances as much as possible. So they're going to disrupt relationships that that person has with friends. They're going to try to isolate them from their families. They're going to make it real difficult for them to reach out, whether it's by causing fights, or making excuses why they shouldn't see, moving them across the state away from where all their people are. Or if it's, I'm trying to think of what other specific examples, but the isolation piece is big. So that's a big barrier. It's hard to reach out if you don't feel like you have anybody to reach out to, which is part of that isolation.
So,
Mhm.
so what help or what support, how does one help, whether it's a man or a woman? How do you help them be able to leave? What does that process look like?
Sure. Well, I think what's really important and what's hard sometimes as friends and family is to be that support person in general, right? Because you can see these behaviors, you see how that's impacting your loved one, and it's hard to feel like you're just sitting by and watching them go through it, right? Or maybe you help them leave one time and they go back, because on average it takes a person 7 times to leave an abusive relationship. I know we didn't get too in depth into all of those barriers and those reasons why, but there is a lot, and that's why it takes people an average of 7 times to leave, right? Um,
Well,
so
maybe Kate, maybe we could talk a little bit about why it's difficult to leave or
sure,
those barriers.
go back into that a bit, and then we can talk about the support piece. Okay, so
Sure.
talked about the isolation. um Financially, if that person is like, no, I don't want you to work, or no, I'm going to work, I want you to stay home with the kids, those types of things. So like, if you don't have any money to do anything, or you don't have access to the money, how are you gonna, money makes the world go around, right? So you're not gonna be able to do a whole lot with that. So controlling the money or other resources, like, do you have your own car? Do you have car keys? Do they hide those from you so that you're not able to go out? um Worked with people that sometimes their partner, not sometimes, in certain cases, people weren't even allowed to like go out and get their mail from the mailbox without their partner being home. So that, depending on their partner for childcare, or even some of our own family values, right? Or religious values. We don't believe in divorce, or divorce would be bad, or we want to stay together for the kids. A lot of those reasons contribute to people staying in these relationships too. Or maybe I'm not being hit, so it's not that bad, just the emotional and mental aspects of it, which is still intimate partner violence. But we find ways to justify things to us, right? Because even though that person might be abusive, they're not abusive all the time. They do have these shining moments. You do have care for that person. It's not cut and dry. It's not easy. It's hard to leave healthy relationships sometimes if there's a difference in values, or different ways of living, to kind of part ways with that. So let alone without having these extra layers of dependence on that person, which makes it difficult. So as support people, it's important that you also can get support, because like I just talked about, why it's hard to watch people experience those things. But how we can support people is really just by being there and listening to them. Victims of domestic and intimate partner violence, because of manipulation and that minimization, it takes a huge toll on people. People think that they're crazy. I've had a lot of people come and talk to me and be like, I feel like I'm crazy, I feel like I'm losing my mind, nobody's going to believe me. They appear one way in public, but behind closed doors they're a different way. So that's just another way to create dependence on that person, if they don't think that they deserve better, or if they don't think that anybody else is going to love them, then they're not going to try to leave. They think that that's what they deserve. So it's like a breaking down process within that relationship too, that emotional abuse. So believing them when they say these things, being there for them when they're ready, and ultimatums and trying to push people to do things before they're ready can actually create unsafe situations. When people leave an abusive relationship, that is the most dangerous time for them. And that's actually when we see like the homicides and the things in the news. More often than not, it was because that person was trying to leave, or that abusive partner suspected that that person was leaving them, and that's why it escalated to that point.
So, in speaking of that, what do you find as barriers? Now, I know, Katie, you've worked to create like a ride-along program with the police officers. I mean, are they helpful? Do they need more? Not how does law enforcement come into play when they get a call in for a report for domestic violence?
Sure. So actually, so Turning Point does, we partner with quite a few law enforcement agencies in our area to conduct the LAP program, um, which is a lethality assessment program. So when law enforcement arrive, those that have been certified in this program, when they arrive on the scene of a domestic, they go through some questions with the victim to kind of determine lethality risks, for homicide and things like that, to try to prevent that. And so when they do that, part of that program is to connect the victim to advocacy services so they can understand what's available to them, that there's support and things for them. So that is one of the programs that we partner with them to do. So it definitely requires training and open-mindedness, because law enforcement experiences burnout like a lot of human services or other professions. Too, if you are continuingly being called to the same house for arguments, some people are going to respond differently, maybe get frustrated and things like that. So it's
Like
important.
I was on that point, Kate. I just want to say it must be frustrating then for the officer, oftentimes, if they get in that situation and then the victim is not willing to press charges, or they're not. So they probably feel often that their hands might be tied.
And that's the case, right? We talked about all these barriers for that person leaving. So their partner being in jail is going to, so if your partner has access to all of the money, you got a kid, you need to go grocery shopping, you need to get diapers, you need to get all of these things. And then your partner is going to be in jail for the weekend until they have initial appearances on Monday. That's going to put you in a bind for things that you have no control over, that you didn't do and that you didn't deserve. So a lot of times, when law enforcement is being called, it's a neighbor calling, or it's that person calling just because they want the abuse to stop. They want to be safe. It's not that they necessarily want their partner to go to jail. It's not that they necessarily, want them to be taken away. It's that they want what they're experiencing to stop in the moment. And so that is why training and understanding of this is so important, because responding to domestics is dangerous for law enforcement as well, because of what we talked about, the escalation with the homicides and things like that. It's dangerous for them to respond as well. So to partner with advocates is super important, and how needs are going to get met and how people are going to obtain safety is training and understanding these dynamics, and then also getting them in touch with resources.
That is just a lot. I know we're just, touching the surface, but Katie, you've given us a lot of great information. Is there anything that you feel you'd want to share that we haven't touched on in bringing awareness or in supporting a victim of domestic violence? Anything that we haven't touched on, maybe?
I think just to reiterate that again, it's not that person's fault. They don't deserve it. Um, and that we want to give that person the agency they need to, they should have control over their lives and their decisions. And that's, the goal as advocates is to help them regain that power and control back over their lives. So if you suspect that somebody you know and love is experiencing that, ask them how they're doing. Ask them how they're doing. Be genuinely listen to them, genuinely believe them, and be there when they're ready, right? So we understand now all of the reasons why it's difficult for somebody to leave. So pushing and adding additional shame and guilt is not going to help. It's not going to help them. So yeah, I would just encourage people to look more into the issue, learn a bit more about that. And we can certainly talk again sometime if we haven't gone over it in one of our previous talks about, warning signs and things to look for too.
And maybe Kate, maybe just as we wrap up, maybe that would be a good way to end is for people that may be family members or friends, what would be some of the warning signs that they may be a victim of domestic violence?
Sure. Some things to look for is if, changes in that person. We can keep it together. People are strong and people are resilient. We can keep it together a lot of the time. But there will probably be some changes in behaviors in the way that that person presents themselves. Are they let's say, for example, you've seen them at church, right? You've seen them at church. They come dressed to the nines, have a nice dress on, makeup, all of those things. And then they're with a new partner, and a couple of months down the line, you see them be more modest, some of those changes. So just be like, I used to, I really enjoyed your outfits and I really liked how you did your makeup. I've noticed that some things have changed. Are you okay? Everything going all right? And just presenting the opportunity for people to talk about things if they need to. So not being allowed or making excuses to hang out with friends anymore, to see family members, just being restricted, having to ask permission to do things, leave the house, go meet up with people. There's one thing to talk to your partner about shared plans and things like that. It's quite another to have somebody have control over those aspects of their lives. So are people free to move as they want to move? Are they still able to partake in the things that bring them joy? Those are some things to kind of look for.
Well, thank you, Katie. I really appreciate you taking the time. I think this is really important information for both, the potential victims that are out there, and also for the people, the general community that are not a victim, but maybe around someone. And hopefully it's brought some understanding and awareness for both sides. And number one, there's help and there's support out there. And number two, how those of us that may be around or know someone that may be a victim, how we can support them and just try and get a better understanding of what they're going through. So I really appreciate it. And again, if you need to, as Katie mentioned, you can reach out. There's the National Domestic Violence Hotline, could find an area, resources in your area. And I'm sure Katie will have you back again, but I just want to say thank you so much for taking the time to share and discuss this important topic.
Yes, thanks for having me.